A recent study linking a niacin derivative to an increased risk for cardiovascular events has raised questions about the safety of this B vitamin, which is added to many food staples in the Western diet and taken in the form of supplements. The findings, which were recently published, may also help explain why taking niacin, which lowers low-density lipoprotein cholesterol and raises high-density lipoprotein cholesterol, did not lead to a reduction in cardiovascular events in major clinical trials. But could this essential micronutrient really have an adverse effect on cardiovascular risk, and what are the implications for niacin intake? Dr. Stanley Hazen, MD, believes some prudence on excessive niacin intake may be justified. I'm not suggesting we should completely avoid niacin, it is an essential nutrient, but the study suggests that too much may be harmful, Hazen said. Niacin supplements are also sold with claims of anti-aging effects, arthritis relief, and boosting brain function, although none of these claims have been proven. And the related compound, nicotinamide, is recommended to prevent skin cancer in high-risk patients. However, a recent study questioned that guidance. Residual cardiovascular risk. Hazen, who is chair of the Department of Cardiovascular and Metabolic Sciences at the Lerner Research Institute, Cleveland Clinic, Cleveland, Ohio, explained that they did not set out to study niacin. It began as a study to look for novel pathways involved in residual cardiovascular disease risk, the risk for cardiovascular events after adjusting for traditional risk factors such as cholesterol, blood pressure, and diabetes. The researchers began looking for compounds in plasma that predicted future adverse cardiovascular events in individuals undergoing elective diagnostic cardiac evaluation. Two of the leading candidates identified were niacin derivatives, 2-PY and 4-PY, that are only formed in the presence of excess niacin. They then developed assays to measure 2-PY and 4-PY and conducted further studies in two validation cohorts, 2,331 U.S. individuals and a European cohort of 832 individuals. In both cohorts, elevated plasma levels of 2-PY and 4-PY predicted future adverse cardiovascular events, with a doubling in cardiovascular risk seen in those with levels in the highest versus the lowest quartile. To move beyond these observational studies and to explore a potentially causal relationship, Hazen's team went on to perform genome-wide association studies and found that genetic variants that tracked with higher levels of 4-PY also linked to levels of the inflammatory marker, vascular cell adhesion molecule 1. And in cell culture and animal studies, they found that 4-PY was a driver of inflammation, upregulating VCAM1 and eliciting vascular inflammation responses.